Beneficial effects of endoscopic screening on gastric cancer and optimal screening interval, a population-based study. Introduction. Gastric cancer remains a major public health concern worldwide, with half of new gastric cancer cases and deaths occurring in China. Most cases are diagnosed at advanced stages, leading to unfavorable overall prognosis in China. Endoscopic screening can prevent gastric cancer by early detection and treatment of asymptomatic early-stage gastric cancers and its precursors, and has been shown to be a cost-effective approach in Japan and Korea, which adopt nationwide screening programs. In China, the endoscopy-based National Upper Gastrointestinal Cancer Early Detection (UGCED) program was launched and has been running in selected areas since 2012. Instead of one-time screening only, individuals diagnosed with advanced gastric lesions are advised to undergo annual endoscopic surveillance. Despite a previous study reporting the effect of one-time endoscopic screening on upper gastrointestinal cancers in areas at high risk for esophageal cancer, no such studies have been conducted in the real-world scenario for populations at high risk for gastric cancer, and the extra value of repeated endoscopy is unclear. It is worth noting that the current guidelines on the time intervals for repeated endoscopy for individuals with advanced gastric lesions were developed from limited expert experience. Data need to be gathered to determine the optimal screening intervals for repeated endoscopy for different gastric lesions so that the benefit of gastric cancer screening can be maximized. To fill the knowledge gap, Li et al. Conducted a population-based prospective study to evaluate the effectiveness of endoscopic screening in Linkou County, a rural area in northeastern China that has one of the highest gastric cancer mortality rates worldwide. The authors examined the changes in gastric cancer incidence and gastric cancer-specific mortality associated with one-time or repeated endoscopy, as well as gastric cancer prognosis. They also examined screening intervals for repeated endoscopy for individuals with endoscopy-detected gastric lesions of different stages. Methods. In a population-based prospective study, Li et al. Included 375,800 individuals, 14,670 of whom underwent endoscopic screening, in 2012 to 2018. The authors assessed the associations between endoscopic screening and risk of incident gastric cancer and gastric cancer-specific mortality, and examined changes in overall survival and disease-specific survival following screening. The optimal screening interval for repeated endoscopy for early detection of gastric cancer was explored. Results. Ever receiving endoscopic screening significantly decreased the risk of invasive gastric and gastric cancer-specific mortality, particularly for non-cardia gastric cancer. Repeated screening strengthened the beneficial effect on invasive gastric cancer-specific mortality of one-time screening. Among invasive gastric cancers, screening-detected individuals had significantly better overall survival and disease-specific survival than unscreened individuals, particularly for those receiving repeated endoscopy. For individuals with intestinal metaplasia or low-grade intraepithelial neoplasia, repeated endoscopy at an interval of less than 2 years, particularly within 1 year, significantly enhanced the detection of early gastric cancer compared with repeated screening after 2 years. Conclusion. Endoscopic screening prevented gastric cancer occurrence and death and improved its prognosis in a population-based study. Repeated endoscopy enhanced the effectiveness. Screening interval should be based on gastric cancer severity.